It is often said or written that once the type of stimulation, tahrik, causing the disease is determined, the treatment should be to produce the opposite stimulation for healing. However, this formula is not always correct or effective in every situation. In chronic diseases and diseases caused by chemical stimulations, this principle is generally followed for recovery. But sometimes, even in these cases, the rule has to be temporarily broken. For example, in conditions such as colic pain or severe chest pain, the pain may be stopped by using medicines that act on the same stimulation that produced the disease. Medicines such as opium, Papaver, somniferum, latex, or Barshasha may stop colic pain temporarily. After stopping the pain, the treatment must again follow the proper therapeutic principles. However, in mechanical stimulations, which can sometimes create extremely serious conditions, the usual therapeutic rule may need to be broken. This should also be considered part of the principles of treatment. As explained in the previous part regarding cholera treatment, remember that mechanical stimulation cannot remain hidden. If it develops naturally after chemical stimulation, or if it is artificially triggered, it may bring relief at first. But if it becomes severely unbalanced, it can rapidly push the patient toward death. Acute diseases are generally the result of mechanical stimulation. Chemical stimulations. Now we are left with the 3 chemical stimulations. Their symptoms are usually old and recognizable, so they are easier to understand. Often the patient's own description of symptoms is sufficient. However, sometimes diseases may involve 2 or 3 types of stimulation simultaneously. In such cases, diagnosis can be made through urine examination, pulse examination, laboratory tests. Importance of electrolytes. Since our current discussion concerns salt, it is important to mention that electrolytes are extremely important in allopathic medicine. Electrolytes are mineral salts dissolved in body fluids, and they exist in a specific balance with water in the body. If this balance is disturbed, many disorders can occur. In severe deficiency of certain salts, death may even occur. That is why electrolyte testing is very important in modern medicine. Electrolyte imbalance is commonly observed in liver diseases, kidney diseases, convulsions or seizures, epileptic attacks. Sometimes seizures or sudden body movements are misunderstood by people as possession by spirits or jinn, where hands and feet twist uncontrollably. In reality, many such conditions are caused by electrolyte imbalance. Unfortunately, many people still attribute such medical problems to supernatural causes, while the scientific world has progressed far beyond that. Common electrolyte imbalances involve minerals such as sodium, potassium, carbonate, calcium, phosphorus, magnesium, sodium deficiency, hyponatremia. Let us first understand sodium, which is part of the common salt we consume daily. In modern medicine, sodium deficiency is called hyponatremia. The normal sodium level in the blood should be 135 to 145 milliequivalents per liter, MEQL. If this level falls below 130 MEQL, it is considered sodium deficiency. This deficiency can be detected through laboratory tests, physical symptoms. The symptoms become more severe when sodium levels fall below 120 MEQL. If the sodium level drops suddenly rather than gradually, symptoms may appear even at 130 MEQL, and the effects can immediately be seen in the brain. If the deficiency continues for a long time, it may cause permanent brain damage. Symptoms of sodium deficiency. Some common symptoms include loss of consciousness, drowsiness, mental dullness, confused or incoherent speech, using incorrect words, nausea and vomiting, extreme weakness and fatigue, muscle cramps, seizures, coma, causes of sodium deficiency. Generally, sodium deficiency occurs for 2 main reasons: excess water in the body, which dilutes sodium levels, dietary habits with very low salt intake, or people becoming accustomed to eating very little salt. The remaining discussion will continue in the next part.